So, like we discussed, most patients with inguinal hernia require treatment, be it all indirect hernias, all symptomatic hernias, all younger patients with hernia. Only selected patients with small direct hernias in the very elderly, I think those kind of patients we can just follow up. And then of course there's sometimes patients who have no symptoms but the ultrasound shows there's a small hernia, occult hernia. We would generally avoid treatment and just keep them under follow up and do the surgery only if they're symptomatic. Once you've decided the treatment for inguinal hernia, what is the ideal treatment for inguinal hernia? One thing we are clear over the years, initially they used to try to repair the inguinal hernia just by suturing the native tissues together. Now that has not been very successful. Now the best way to treat an inguinal hernia is tension-free mesh repair. That means we bring the tissues together in a tension-free fashion and reinforce it with a mesh. Because the native tissues have failed here, the hernia has occurred. So you need to reinforce it with a mesh. That mesh forms the matrix for a tissue growth, and this is a permanent mesh. The mesh remains forever in your body because it forms a framework on which new tissues grow, and it creates a new strong layer to prevent a recurrence. So this can be done by obviously open or laparoscopic hernia repair. Open has been there for the past 50-60 years. It is still a good surgery, but now the standard of care is laparoscopic repair for inguinal hernias. There are two types of laparoscopic repairs, a TEP repair and a TAP repair. Both are equally good, depends on the expertise of the surgeon and what he's comfortable with. Both are equally good for both types of hernias. The advantage of laparoscopic hernia repair is basically we do it through a keyhole surgery. Very tiny scars, 5mm scars are placed even if you have hernias on both sides. So because I told you it's a congenital problem for indirect inguinal hernia, patent process vaginalis, several patients can have bilateral hernias. So with the advantage of lap is the small incisions, 5mm incisions. Even if you have hernias on both sides, you can do it through the same incision. The chance of postoperative recovery is very quick. There's not much of pain. The patient can get back to work within 1 or 2 days after surgery. The chance of chronic neuropathic pains is very less because when you put open meshes, the nerves can get entrapped in that, and then you can have chronic pain after the surgery. The chance of that is very less with the laparoscopic repair, and cosmesis wise is a big advantage. In some particular hernias, like very large direct hernias and large indirect hernias, laparoscopic in that specific area, laparoscopic repair has an advantage over open repair because we'll be using a very much bigger mesh we are able to place from the abdomen side in the lap. That same side of big mesh we cannot place in open surgery.